A cartilage anchored tube can be placed in an ear which requires chronic intubation but which spits out tubes too quickly. Cartilage anchored tubes are easy to manufacture and can stay in for 4 to 6 years. In order to make one, we use a cartilage graft and a cartilage slice that is made with a cartilage slicer. This slicer is designed like a food mandolin. It has cartilage and perichondrium. The cartilage is placed. It's tightened just finger tight. The bed of the slicer is moistened, and then it is drawn, creating a thin slice. These thin slices are ideal for anchoring tubes. The cartilage anchor is, I'm going to use a T-tube that is a T-grommet without a long stem, and I've selected a 5-suction whose diameter is approximately the same diameter as the outer shaft of the tube. I'm going to punch a hole in the cartilage, and I'm working hard around the edges to cut the perichondrium associated with the cartilage slice. This sometimes requires skiving the tip of the suction against a hard surface like metal to complete the cut. You can tell the cut is complete because the suction passes all the way through. We now have our cartilage slice. We will now place the T-tube on our block. We'll place the slice over the T-tube so that the tab on the lateral surface of the tube protrudes through the hole, and grab that with an alligator. We then slowly pull the flexible silastic tube through the slice so that the tube now has a large cuff of cartilage. We can now slice the extra cartilage away from the tube that is not going to be necessary. To create a tube cartilage complex that is placed beneath the drum through a very large myringotomy. If there is a perforation in the drum, and as in this case, an anterior perforation, we are going to reconstruct the perforation with this cartilage and the integrated tube. Can you see that there? That is the tube cartilage complex. And the other side. Thanks.
Turn it off.